Welcome back in. This month is Asthma and Allergy Awareness Month. It's something many people deal with every day. It's also something the Toledo-Lucas County Health Department is working with local school districts to help manage. Shannon Jones from the Health Department and Elizabeth Harris with Springfield Local Schools are here with us to explain what's going on. Good afternoon. Thanks for being here today.
Hi, thank you.
Be here.
So let's talk a little bit about asthma. Are we seeing an increase in cases with kids?
Absolutely. Springfield Local Schools has about 10% of our students that are identified as asthmatics, and we know there's far more that are unidentified hanging out there.
Okay, yeah. Anything with the county overall?
Yeah, sure. So pulling data from the Ohio Department of Education, the Ohio Healthy Student Profile shows an increase of asthma across all of the districts in Lucas County with an average about 35%. So it is significantly increasing from year to year, we've seen.
So these kiddos having trouble breathing, you know, and the spring is particularly hard, I feel like, with allergies and everything going on, and us just being outside a little bit more. So talk a little bit about initiatives that you all have going on to help out with this.
So Springfield Local Schools partnered with Lucas County Health Department over a grant that we received and to identify some of the issues within our district, such as environmental factors, carpeting, air purification systems, simply recognizing the students who have an issue and communicating with the physicians to get those medications and those plans on board to be able to be utilized in the school.
Oh, wow, that's big. You know, carpeting, you know, we don't think about everything that is around us and how it impacts our ability to breathe. So you said through a grant?
Correct. Yep, we worked with a grant to identify those issues, and now there's actually going to be a second stage to see what kind of funding might be able to be assisting the district to help change those things.
Okay, we want everybody to breathe a little easier, don't we?
Absolutely.
Yeah, so let's talk a little bit about let me make sure I say this right, the albuterol inhaler program. Did I say that right?
Yep.
Yes. So talk a little bit about the stock program.
Sure. So we did some research during COVID, believe it or not, as to any type of asthma support we have locally for kiddos. We were trying to build out our childhood wellness program. And actually, the stock albuterol program was the impetus of us building out the first program in childhood wellness. And we had realized that there really wasn't a whole lot in the schools. Across the country, there are several other states that have stock albuterol programs in their schools where in the event there's respiratory distress that's identified or an asthma emergency, they have access to an albuterol inhaler. And I thought, okay, well, we should probably look to start having these conversations. But it wasn't as easy as one may think. There is a lot involved with it. And of course, working as public sector, we are governed by Ohio Revised Code, Ohio Administrative Code. You know, what's the law say about this? Because states have laws enacted that allow schools to have emergency access to inhalers for those who are in need. Luckily, the state of Ohio has that as well. So we went ahead and did our research and started working with Washington Local as indicated in 2022, looking to increase the availability of these inhalers in the school, starting with policy change, procedure implementation, and moving forward with it. Now we started with about 10 schools in Washington Local. A year later, we added about 58 more with Toledo Public, and then have expanded our partnership with Springfield.
Wow, so have you had to really use these inhalers?
We have had to use our inhalers on not only students, but it can be used in our policy at our district for any visitors or staff that are on site and may have issues as well.
So it has helped students, it's helped staff, and when it comes to stock medications, you said there's, you know, revised code, there's red tape, obviously, to get through. But are there other medications that are accessible? At
Springfield Local Schools, we have 4 stock medications. So we can use glucagon in use for our diabetics. We have epinephrine for allergy emergencies. We have the albuterol inhalers, and then we also carry Narcan.
Wow. So this is a big step that you all took. Started with what? 10 schools, you said, and then now you're at a ton.
Yeah, we started, actually this program wasn't even funded when we first started to put this together. It was just like, okay, there's a need in the community, let's do what we need to. And it happened right after COVID, so God bless the nurses who were willing and able to take this on, because it's a heavy lift for those school nurses.
Sure. So, but helping students, as we can see.
Absolutely.
Wonderful. So spreading that awareness this month, Asthma and Allergy Awareness Month, and it sounds like the county's doing some really great work there. Thanks for being here today.
Thank you.
Appreciate it.